And thanks also to Tommy, Chip, and the Chamber. We appreciate the opportunity to join the call today. I'm Sunita Singh, the Public Relations Manager for Northeast Georgia Medical Center, Barrow. With us today are a few people from Northeast Georgia Health System. Chad Hatfield, you need absolutely no introduction to him. You know him as the president of Northeast Georgia Medical Center, Barrow. He's also the vice president of Regional Hospital for Northeast Georgia Health System. I also have Dr. Supriya Manapalli. She is our infection control physician and one of the clinical leaders of NGMC COVID-19 task force. During this time, I don't think we could have done without her expertise at Northeast Georgia Health System level. Third guest is Luke Lenihan. He is a physician assistant with NGPG, Northeast Georgia Physician Group, and his focus is occupational medicine. And you'll find a lot of good tips for your businesses, so make sure you stay on until the end. One of the benefits of our local hospital being part of a large regional health system is having access to all these experts. And when they were contacted for today's presentation, everyone was so glad to share their knowledge with Barrow County. With that said, I'm going to turn it over to Chad to talk a little bit about what we are seeing at Northeast Georgia Medical Center, Barrow, and also across the region. Chad, take it over.
Hey, thanks, Anita. And I also want to say, give a special thanks to Jackson EMC for allowing us to present this program today, and to Tommy and the Chamber of Commerce. I know this is unprecedented times, and so we appreciate all the support and the community working together to try to do what's best for our members and our neighbors. I hope there will come a time when we don't have to talk as much about COVID, but it's our reality today. After our region was hit hard by the pandemic in April and May, we saw the number of cases at NGHS drop considerably in June. We believe that's in a large part due to community answering the call to stay at home as much as possible, wear a mask, maintain their social distancing when they went out, and wash your hands. Unfortunately, since a time shortly after the 4th of July, we've seen our COVID cases increase rapidly. And of course, we all know the situation with the school systems dealing with at last I heard, about 90 employees have tested positive after staff returned for pre-planning activities. So if there's anyone from the school system on the line, we just know that you have our thoughts and prayers. As of 7 this morning, so I'll give you a little report out on the system. As of 7 this morning, our teams are caring for about 160 COVID positive patients in NGMC hospitals. Out of those, 2 of those patients are at Barrow, and we currently have 9 patients at Barrow that are, we call patients under investigation, that we're waiting for test results to roll them out or confirm that they are positive for COVID. Since the pandemic hit, we realized that we needed a focus on intensive care that allowed for intensivists to be able to manage these patients. So we relocated our ICU beds at Barrow to Gainesville during the pandemic, so we wouldn't have physicians driving to multiple locations, and that we could concentrate on those patients in 2 locations. And so that's Gainesville and Brazelton. So we've followed a protocol to transfer most of those COVID patients to Brazelton and or Gainesville, especially as their condition deteriorates or needs a higher level of care. So while that number of local patients may seem low, keep in mind we're seeing plenty of cases in Barrow County. So during the past 7 days, NGMC Barrow has seen 13 positive results from 111 tests. That's an average of about 12% of all tests coming back positive. And to put that into perspective, it's just slightly higher than the state average. The state's averaging about 11% of positive tests from their total testing amount. Barrow County's also seen a sharp rise in the total number of cases. So out of our total case count of 1,296, 352 of the county's 1,200 cases, or a third of those, have been confirmed over the past 2 weeks. So you see the past 2 weeks, we've seen a big surge in that a third of our total cases since the pandemic started have been actually tested positive and confirmed over this past 2 weeks. Plus, if you look at the 7-day rolling average of new cases per day, it's hovering around 25, which is by far the highest it's been in Barrow County since the pandemic started. So not only have we seen it, but we're still seeing that number continue to increase. Some of these higher number of cases may be due to increased testing, but also keep in mind there's likely still plenty of cases that we don't know about. When you look at all the data and you consider that Barrow County borders Hall County and Gwinnett County, which have both been hotspots of COVID activity compared to most of the states and many parts of the nation, it really puts us into perspective on how serious we need to take this virus. So we're sandwiched in between two hotspots, which, it's actually surprising that we don't have a higher rate in Barrow County today. We're not sharing these numbers with you to try and scare you. We just want to be transparent with what we're dealing with and be honest about what we've actually seen in our hospitals within NGHS. We are doing all we can to keep all of our COVID and non-COVID patients safe, and we want to remind you how important it is to seek healthcare if you need it. And so we're still seeing people delay care, and that's never a good idea. And when I say delay care, I don't mean on the elective cases. I mean, we have patients come in with chest pain that they've been having chest pain for a day or several days, but they've been avoiding coming to the hospital because they're more scared of contracting COVID. And so that's never a good idea. We've also seen stroke patients who have delayed calling EMS for strokes, delayed it 6 to 12 hours. And strokes are very critical to get to the hospital and to get treatment as soon as possible, because we all know in the sense of strokes, time is brain. So the longer you wait, the more brain cells you lose. For heart attacks, strokes, and other medical emergencies, quick treatment, it can be the difference between life or death. For more routine things, small problems can become a big problem in a hurry. So, we just want to make sure that we're taking all the precautions and staying safe, but just reminding the community that if you are in an emergency, have an emergency medical condition, please don't hesitate to seek treatment at your closest emergency department. Patients and visitors are still screened at the hospital for COVID symptoms when they enter the hospital or any other location. All of our staff are wearing masks, and patients and visitors are given masks if they don't have one. Our employees wear more PPE when needed, such as face shields, gowns, and we follow strict decontamination guidelines here at the hospitals. Our NGPG and Heart Center offices support social distancing in the waiting area, so we've tried to be mindful of following all the criteria and guidelines for prevention. We also offer video visits, so if some people would rather stay home, they can talk to their doctor on Zoom just like we are here. And as always, remember our emergency department's open 24/7, so we're ready if you need anything. So with that being said, I'm going to turn this over to Dr. Manapali, and she's now going to tell us about how your loved ones or your workforce can stay safe. So Dr. Manapali.
Thank you, Ted. You went over such important points already, but I'll build on that a little bit. As this community's health system, it's our duty to continue to urge people to be cautious. This pandemic is far from over. I mean, when we started planning for this, we thought maybe this could be, I don't think I would have expected this to last this long, but this is nothing like we have seen in our lifetime. We cannot stay shut down or locked down for long. We need to move on with our lives, but we need to do that with awareness and caution of how to prevent this infection from spreading. I think we know enough about this virus now that there's some basic steps we should continue to take in the next few months, which will be extremely crucial. avoid gatherings that are large, and especially those who are high risk, those above 65, immune compromising conditions. The mortality risk is very, very high. These are the patients who can have a more severe presentation. Do not get out of the house unless it's essential. But if you do, please wear a mask and make sure that you're performing good hand hygiene, and maintain 6-foot distance from others as much as possible. And again, I cannot emphasize enough about the mask use, because when we all wear masks, we're protecting each other. And if you have, and get familiar, we need to be familiar with the symptoms of COVID. I've not seen a great mimicker than COVID. It's not just cough, fever, shortness of breath. Any new symptom onset in this time, we should first think of COVID, whether it's sore throat or some myalgia, muscle aches, or diarrhea, nausea. There's just variety, of course, the loss of smell and taste. So with any of these symptoms, seek medical care and get tested using a PCR test. If any of you have had an antibody test, because we don't know enough about it, just still take all the precautions, because we don't know if that confers us the immunity or not. And stay home if you have these symptoms. Do not go to work, because we can expose our colleagues and others at work to this virus. And just continue to remind your employees and co-workers about these simple steps. Fall and winter are going to be very different this year. As schools and colleges open, we start preparing for the flu season. But this year, every flu-like symptom is a COVID suspicion. So we need to rule out both flu and COVID. So every year we should be urging people to take the flu vaccine, but this year that is of utmost importance. What we do in our community together to take these basic steps, take the immunizations needed, will help us to have the hospital beds available for the sickest of the sickest. And again, especially those in the high risk category, you need to take all these precautions. And again, it's really hard to predict how things are going to evolve in the next few months, because we thought we had reached our peak in April, then we downtrended, then we had another surge again. It looks like a roller coaster that keeps going up and down. Which turn will be bigger, we do not know. But we just need to continue to be cautious. And you can help keep safety and precautions on everyone's mind in a positive way by joining our Wear a Mask campaign on our Facebook, Instagram, and Twitter pages. You may have already seen those. We have had several community members and leaders urging people to wear masks to protect others. Please continue to spread that word. And several members of the Barrow community have already been featured in this campaign. And also, please look into our NGHS pages to see our latest COVID data.